Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who'll be answering your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Katie Berg, who was an intern this summer with the Institute. And Katie, I now turn it over to you.
Thank you so much, Kristen. And thank you all for submitting your questions. And again, Dr. Murphy for being here and continuing to answer them. Starting off today, we have some very important news about breakthrough infections. Dr. Murphy, what can you tell us about breakthrough infections thus far?
Well, nothing is 100%. No vaccine is 100% for anything. But the vaccines, despite the invasion of the Delta variant, which is much more contagious, but behaves about the same once it gets in the person, the vaccines work against this. But the efficacy rate for the mRNA vaccines, the Pfizer, Moderna, is about 90%. For Johnson & Johnson, for severe disease, hospitalization, and death, it's also about 90%. Actually 100% for, almost close to 100% for death and hospitalization. So the vaccines are working. They're fine, but people are still getting infected. Now, when they get infected, they tend to have a lower amount of virus in the body. The body is able to handle it much better. That's why they don't get too sick. But that is still an infection. And we're not really, we think that this pool of people, the breakthrough people who've been vaccinated, fully vaccinated, they get sick, they can actually, feel very much under the weather and be out of work. They're going to be in quarantine for 10 days, of course. But how contagious they are is a big question. It's probably very low, if at all. That question should be answered pretty soon. But that's not the group that's spreading it, through the country right now. And we're having a huge uptick in cases, particularly in the states that are under-vaccinated. That's really what a breakthrough infection is. We don't know the long-term consequences of breakthrough infections that are mild to moderate. Typically the mild to moderate cases are not having as many long hauler type symptoms, but it can happen. So we have to keep our eye on that.
Right. And what, if any, efforts do you know that the federal government has been making to help those who have been affected by severe COVID?
Yeah, so the Biden administration actually announced yesterday that people with long COVID and effects from having a COVID infection may soon qualify for federal disability under the civil rights laws, including the Americans with Disabilities Act. So it's basically becoming a mainstream disease and problem, eligible for all sorts of health benefits, which they deserve.
Right, that's great news. And last week, we found out that the Chicago Public Schools is going to have a mask mandate. Can you tell us your reaction on that?
Well, what the Chicago Public School system is doing is taking the most cautious approach, which I concur with, and as do many other experts, as does the American Academy of Pediatrics. They came out very strong in that schools need masks, everybody, vaccinated, unvaccinated, whatever. It's just too big of a mix of vaccinated and unvaccinated people. Most of the kids, of course, don't even qualify for the vaccine. The ones, excuse me, 12 and up that are in school have a very low vaccination uptake rate for whatever reason. And so therefore, they're saying everybody should be masked. And the Chicago schools are going for that. That's certainly not happening everywhere in Chicago. The Archdiocese is following the CDC guidelines, which say vaccinated people don't need a mask. So there'll be a mixture in those schools that's following CDC guidance. And the state is more following the CDC.
Mm-hmm. And have we seen any mask mandates at a greater scale? And do you anticipate that we'll see more of them?
Yeah, good, very timely question, Katie. Because as a lot of people have already heard, all of LA County, 10 million people, the most populous county in America, The city of St. Louis, which is getting inundated with cases, have reintroduced mask mandates right now. The CDC announced, or there was an announcement coming from the CDC or somebody around the CDC or something, that new guidance would be coming out shortly. I don't know if that means today, tomorrow, or Monday, on gatherings and whatever. It would likely not be like one of these implementable immediately things, but like Monday or something like that, you know. So expect new guidance soon. The numbers of new cases are increasing so fast that we've got to do something, or we're going to have yet another giant spike in infections, predominantly in the unvaccinated group. But again, some of these breakthrough cases will also be part of that whole thing. And this is going to really set us backwards. And in certain areas where the vaccination rate is really low, are really going to get hit hard. Basically like New York at the beginning of the pandemic.
Yeah, so we have to stay alert and look for that announcement when it comes out. Switching over to some of our submitted questions, we have a great question from a viewer whose parents were concerned about getting the vaccine until it was fully authorized by the FDA. So what is the process of full authorization, and how far away are we from seeing our vaccines fully authorized?
So typically for vaccines, they follow the last patient studied for approximately a year before they consider full approval. Now, if we did that, the vaccines would not be approved today because the last patient hasn't been followed for a year. That would actually translate to close to 300,000 deaths. I mean, it's really a stunning number, the number of people that have been saved by the vaccines already, and what has happened with the whole trajectory of the infection. So in a case like that, where it's such a life-threatening situation, the FDA can give emergency use authorization. Now, that does not mean all the procedures to do a study were not followed. All the animal studies were done, all the dosing studies were done, and the 30 to 60,000 person studies actually in patients compared to placebo have all been done. All those patients followed until at least 2 months after the last person got their dose. And the EUA was based on that. And it was clear that the vaccinated people did much better and had improved survival, less hospitalization, less disease, etc. And that's why they got emergency use authorization. So it has nothing to do with experimental design. It is only due to the limited number of follow-up, and the limited number of follow-up was authorized because of the life-threatening situation that was happening in the country at the time that this was approved, which I believe was in December 2020, the end of November or the beginning of December. I forgot what it was. But anyway, nothing else has to be done other than following these people. They're following them constantly. They're out now. The last people are out close to 9 months. And you know, the ones who entered the study first are even longer than that, out to a year. So there's plenty of data. Over 160 million people have gotten these vaccines. And there's kind of really no big surprise in terms of safety. Now, the FDA is going to look, of course, very closely, and people that are having unusual side effects or diseases they think might be related can fill out those VAERS report, VAERS report. Anybody can file one of those. A person or a person's doctor can file it. I filed it for one of my patients recently. And the FDA will look and investigate that. Now, actually, to tell you, the patient that I submitted the VAERS report for, actually, the FDA contacted me to ask me more information about it. So, I mean, these reports are taken seriously. But anyway, so, you know, full approval will be happening, you know, at some time, probably by the end of the year. If, you know, I'm not sure when, exactly what the process is. But there's a mountain of reports that have to be analyzed thoroughly. And if there's any questions, they have to be investigated. All this takes time. This is typical study analysis. So there's nothing unusual about it. And the Biden administration has said they don't want to they want to stay away from the FDA, let the FDA do their job. The FDA, these people understand that this is a crisis now, that that full approval is an important next step in this whole process here. But as you can see from all the mandates that are going on now, including federal government mandates about vaccinated people coming to work, state mandates, school mandates, businesses, airlines are all starting to mandate vaccines before people can return to work. All that stuff, it's been challenged in the Supreme Court. There are other disease models out there. Measles, hepatitis B, etc., influenza for healthcare workers. You know, all that, it has been done before, and those laws are going to hold up. So it's coming, and once there is full approval, you'll see a lot of the more hesitant people, I think, will feel more comfortable if they haven't gotten COVID already, and you know, and they'll maybe will accept it more when it does get full approval, but there's no reason to wait for that.
Okay, that's very good to know. Our next question comes from a viewer whose family member has sarcoidosis and has not been vaccinated yet. And although their immediate family is all vaccinated around them, the family member is still urging this person to get their vaccine. Should they continue to do that?
Yes, yeah, this person is at very high risk of having complications from COVID if they get it. The Delta variant is, you know, much more contagious than the previous Alpha variant and the original virus that was circulating in the United States. So much so that exposure to a person less than a minute is high risk. Remember, it used to be 15 minutes exposure at the beginning. Now it's less than a minute. I mean, it could be seconds. It's so much more contagious. So this person really needs to get vaccinated. They're high risk for complications. They need to get vaccinated now.
Wow, that's a very stark change from what we saw at the beginning, the 1 minute versus 15. Speaking of how we can fight back and try to stay protected, a viewer was wondering, are we in a much better position to fight variants by altering the current vaccine? And if so, would it take less time to alter what we already have rather than make a whole new one?
Well, remember that the current vaccines work against Delta. Now, the problem is going to be the next variant that takes over, if there is another variant that takes over. The manufacturers of the vaccines are already working on a new vaccine to hit these variants. So, you know, that's forthcoming soon.
Mm-hmm. And another viewer who was watching your WGN segment yesterday morning was a little bit confused on how you worded one answer about herd immunity. So a follow-up question they had was, what evidence is there that the vaccines are stronger than developing your own antibodies after catching COVID?
Oh, yeah. So there's a couple questions here, really. So herd immunity is when so many people in the population are vaccinated that the virus just can't transmit in the whole community. That one infection leads to less than one other infected person. That's called the R0 factor. As soon as that R0 factor goes less than 1, the infection process really kind of goes away, and that's herd immunity. And we don't really know what the number is. Maybe 70%, 80%, people are basically just guessing. But it's higher than what we have right now, which is a little over 50%. And we can see clearly in the states that have less than 50% coverage that they're doing terrible right now. It's really a catastrophe. The governors in Alabama and Arkansas in particular have been very outspoken about people got to step up to the plate and get vaccinated, or they're going to implode the whole healthcare system. So it's very important to get that herd immunity. Now, the vaccines are really genetically designed, molecularly designed, I should say, to induce a really strong response. Actually, it's stronger than the viral response. And it's more predictable than the viral response. Because if you get a very low exposure and have a mild infection, you may actually lose your protection quickly. So the vaccine offers the most reliable, steady, and strongest immunologic response, even if you had COVID. Matter of fact, if you had COVID, you already have a little bit of immunity already. and you take the vaccine, you even have a better response.
Right. And our next question comes from a patient with MS wondering if they should receive the COVID vaccine.
Yeah, they should receive the COVID vaccine. They're at much as risk as anybody else. I would stay away from the Johnson & Johnson vaccine with this particular person because of the neurologic side effects that have been associated with it, even though they're incredibly rare. If that was the only vaccine you could get, I guess I would try it. But right now you have an option. You could take one of the mRNA vaccines, which does not have that side effect.
Great. And our final question today comes from a viewer who's wondering about the vaccine trials for children and about the age cutoff. And they were wondering why the age cutoff is 12. For example, because children have very different physical development and maturity at different ages. So she was just looking for a little clarification about that.
Yeah. So because this was developed rapidly, the first group they tested were in adults. And Pfizer had originally got down to 16 and up. Moderna was 18, Johnson & Johnson was 18. And then the next group that was studied was 12 to 17, or 12 to 15 with the Pfizer group. And so far, so good with that. And they got approval down to 12 because of there were no real safety signals there. And then now there are studies going on, several studies going on, and kids 6 months to 11 years of age. Yesterday, the FDA was encouraging the enhancement of the group between 5 and 12 years of age, 5 and 11 years of age. So the vaccines are approved from 12 and up, and so they're that next group down. This is a very typical approach in developing vaccines, where you're ultimately going to get to children who are not just little adults. They're different.
Well, thank you so much for your time, Dr. Murphy. I really appreciate you answering the questions, as I'm sure do all of our viewers. Please continue to submit your questions, and we hope to see you again soon.